This morning, healthcare professionals in several states tell CNN they're still dealing with the fallout from a major cyber attack. Now, the hack disrupted insurance processing at pharmacies across the country a little over a week ago. It targeted Change Healthcare. That's a unit of health insurance IT giant United Health, which processes prescriptions and billing for tens of thousands of pharmacies nationwide. For more on this, we have Molly Smith, Group Vice President for the policy at the American Hospital Association, and Amit Yoran, Chairman and CEO of Tenable, and the former Director of U.S. Cybersecurity at the Department of Homeland Security. Molly, I want to start with you on this really incredible story. What are the impacts your systems are seeing right now?
Yeah, absolutely. First, thank you so much for having us. This is just an unprecedented attack on the entire U.S. healthcare system. And what our members, hospitals, and many of the doctors, nurses, and clinicians that are working in them are experiencing is that it is hard for patients to make appointments, to get prescriptions. It's hard for hospitals and doctors to actually check and make sure that their patients have insurance coverage and then be able to know how much they may need to pay for the services that they're getting. And then for hospitals and doctors, in terms of their cash flow, they are really hampered from being able to send bills to health insurers and then have those health insurers pay them back. So while the impact really varies depending on how much a hospital or doctor's office works with Change Healthcare, all 6,000 hospitals and many, many, many thousands of provider practices are really feeling the pain of the crunch in their cash flow, which makes it hard for them to make payroll, to buy the medical supplies that they need. So really, this is just an unprecedented challenge that we are experiencing.
Amit, can I ask you, do we have any idea who is responsible for this cyber attack?
We do. It's currently believed that an organization known as Black Hat, a group of hackers, Russian-speaking hackers, is the group behind this. And that's the same group that we saw just a short while ago going after and disabling systems at MGM and disrupting their operations.
Amit, following up on that, what are the long-term effects of a cyber attack like this? And how long does it usually take to, clean up the mess after it's already been done?
Yeah, well, it could take, and as we're seeing in this case, and as we've seen in many other cases, if you don't have your systems properly protected, if you aren't prepared for these types of attacks, it could take, and it is taking weeks. It's believed that Black Hat has had access to Change systems for over 2 weeks now, and the disruption continues and continues to get worse for those patients, for those pharmacies that are unable to get healthcare insurance coverage for critical medication. And by the way, that includes pharmacies for the American military hospitals around the world.
Let's talk a little bit more about that. There are things, as I understand it, healthcare professionals are doing to help offset the impact of this hack so patients are able to get the care they need. Tell us more about that, if you wouldn't mind.
Yeah, absolutely. Hospitals and doctors, they are committed to continuing to provide care to patients. They will do everything that they can to mitigate the delays and impact on patients. However, what they're having to do is a lot of manual workarounds to these technologies that are now no longer available. So just take, for example, you go to your doctor's office and you hand over your card, and your doctor's office, their computer is able to very quickly in real time talk to the health insurer's computer and say whether or not they are covered for the service, whether it can be scheduled. That's not happening in many instances right now. So that individual who takes your card is either having to pick up the phone and call the health insurer, and I think a lot of us know what that can be like, or they're having to manually go into a computer system and type everything in and wait for a response on the other side. It's just hugely burdensome and frankly a big strain on our workforce when we're already facing unprecedented workforce challenges.
Yeah, truly I cannot even imagine that. Amit, I wanted your perspective on something, because this stat really, it both surprised me and didn't, just because I feel like we keep hearing about this. I understand nearly 1 in 3 Americans were affected by a health data breach specifically last year, and we're increasingly seeing places like hospitals and local governments becoming prime targets for hackers. Can you just shed some light? Why is that?
Yeah, I think the characterization that this is unprecedented and massive and can have massive ripple effects, I think those are both true. I think it is also true that these types of incidents are highly predictable. We know the hackers that are out there, the organizations that run these ransomware gangs, they're after big payouts. And if you're operating critical system, whether it's in healthcare, whether it's in government, whether it's in entertainment, or critical infrastructure, we saw it with Colonial Pipeline. If you're operating critical systems, there is a strong potential that you're willing to pay significant dollars in ransom to get your systems back and online efficiently. And these organizations need to pay closer attention to their cybersecurity. They need to be much more proactive, assessing where they have problems and fixing those problems before the ransomware gangs take advantage of them.
Amit, one last thing just before we go. I understand what you're saying that the individual organizations need to do, but can you give us an idea of what's being done on the federal level to help prevent some of these cyber attacks, especially if they're coming from outside the country?
Sure. Well, it's important to note that a lot of these attacks are coming from places which do not have cooperative law enforcement agreements with the U.S. China, North Korea, Iran, Russia. And so there's work that can be done through law enforcement, federal law enforcement, FBI, and others, but it's limited. We're seeing a lot of great work happen from the intelligence community, from CISA in particular, within the DHS, which is telling organizations which vulnerabilities out there are being taken advantage of by these hackers, by these ransomware groups. And so the government's doing a lot, but it's really incumbent upon every organization to exercise due diligence with their systems, not operate negligently, make sure they're cleaning up these problems before they get taken advantage of. And I think this is a great example of that.
Molly Smith, Amit Yoran, thank you both for waking up and for discussing a very important issue. I really appreciate your time.
Thank you.
Thanks for having me.